nowadays, it's easy to know what a pandemic feels like. But imagine an epidemic in your neighborhood with no supplies, doctors, or hospitals, and no hope of those ever appearing. Across the world, there are countries plagued with disease and lack of adequate care that need help from organizations and volunteers. Researching this organization, Doctors Without Borders, I've learned how to help these people in different and important ways. Young volunteers like you are needed at Doctors Without Borders because there will always be people in need of assistance. This speech will cover how the lack of global medical care is and can be fixed with your help. Médecins Sans Frontières, MSF, or more commonly known as Doctors Without Borders, is a non-governmental organization that administers aid to people in distress. Doctors Without Borders began in 1971 with the thought that the needs of people who are hurting are more important than country borders. Dr. Bernard Kouchner said that it was very simple: go where the patients are. This was precisely what they did and continue to do. A shortage of doctors will always be an issue, especially in countries where virus and disease consistently destroy populations. This desperate need became increasingly prevalent when the COVID-19 pandemic began. In January of 2020, MSF began COVID-19 relief in Hong Kong by sending volunteers, and then shortly thereafter began preparing for future outbreaks in Southeast Asia and Europe. They have continued to work hard and to provide relief to this day. Measles, another contagious and deadly disease that MSF is another disease that they help to combat. Since 2006, they've vaccinated over 26 million children for measles. Declaring an outbreak after one case is reported at the refugee camps they work at, it ensures the safety of all the people there. MSF provides vaccinations and cares for the infected. Another organization that helps in other countries is Red Cross. However, Red Cross mainly works medically only in America or for American troops overseas. According to their website, globally, they mainly provide relief for disaster survivors, educate public about disease, and promote humanitarian law. All of these work fine, but Doctors Without Borders goes beyond that. MSF also works to provide not only care for the disease, but also provide support that will help them in the long run. They provide vaccinations like described, as well as combat antibiotic resistance and malnutrition. According to Dr. Craig Spencer, the Director of Global Health and Emergency Medicine at Columbia Medical Center, and a man who worked as an epidemiologist in Africa and Southeast Asia, said that MSF also trains locals as physicians, and they provide great help to the doctors that travel there. This makes me wonder, what will happen when there is inevitably another disease ravaging the planet? This background of what MSF does should help you see how your help can benefit more than you think. With your help, MSF can reach more countries and therefore more people. MSF is currently working in over 70 countries. Volunteers are needed to do simple tasks like clerical work as well as more experienced tasks that involve specialist skills. Volunteers can also help with events with fundraising. 85% of the money that is fundraised goes to their previous programs in different countries. If you're wanting to get more involved, you can become a paid intern that works with specific programs and goals. Especially with new COVID variants developing, MSF is working hard to help as many people as they can. With more volunteers who advocate for this organization, more people can be reached and helped. If there are no volunteers at MSF, they could no longer be able to provide all of the relief they're capable of doing. With the outbreak of Ebola in West Africa, medical professionals were dying at an unproportional rate. According to David Evans at the Lancet Global Health, 0.11% of the general population died due to Ebola in Liberia versus 8.07% of their healthcare workers. This leads to a shortage of healthcare professionals. MSF worked to counter the shortage, but there was only so much that they could do. More volunteers could have helped them then, and just as they can now. With resources being stretched to help the world with COVID, MSF needs help now more than ever. Without volunteers to help raise funds, Doctors Without Borders would not be able to continue expansion and would most likely have to move out of countries and abandon the people that they've helped. Now, MSF has worked hard to provide care to people in distress of all walks of life and without discrimination. Across the world, there are countries plagued with disease, lack of adequate care, and they need help from organizations and volunteers. I've learned how to help those people in different ways after researching Doctors Without Borders. You can and should be someone who helps these people in need. Living in the U.S. may have its challenges, but at least we have state-of-the-art medical resources. You can be a part of the movement to have populations around the world receive care like we do here. Imagine that epidemic in your neighborhood again. Now, don't you want someone to come and help you and your family? Thank you.